Hi, this is the diabetes registry I created with my SQL database. So the first thing I did was to build the database registry here, and I chose to develop 4 tables of information. The first table is demographics. And this table consists of the columns of ID, first name, last name, date of birth, city, and gender. When I built the data, I chose ID as the common denominator to identify patients across all of the tables that I've used. Here we have the first names of the 20 patients, the last names, their dates of birth. These are all cities that are in New Hampshire, and I also have gender. The second table that I built was based on diagnosis. And I have 3 columns on this table. The first is the patient identifier. The second column is the diagnosis. And the third column is their A1C levels. The third table I chose to develop was based on eye exams results, if they've had exams in the last 12 months, and whether or not the patient has participated in nutritional counseling. So these are basically yes and no answers along with that patient identifier for each patient. The last table that I developed was medications that the patients are on. These are some common medications that are given to folks with diabetes along with their dose and frequency. Thank you.